Minister is very concerned that
the honourable member for Vancouver Kingsway.
Thank you, Madam Speaker. Before I begin my remarks, I just want to say that when I was first elected, I got an identification card like every member does, and on that card it outlines the privileges of every member, and it says that every member elected to this House has the right to the full run of the parliamentary precinct unimpeded by no one. And what I saw here tonight, when I saw the Prime Minister come over and physically put his hands on the Conservative whip and move him along, was an absolute breach of that privilege. And I'll tell you, that was intentional. The Prime Minister intentionally put his hands on another member and moved him along. In the process, he bumped the member from Berthier-Masconanger, and I just want to say that's unacceptable. Madam Speaker, every year that Canadians must wait for progress on community-based care is a lost opportunity for progress and the kind of innovation that is so critical for our healthcare system. As hospitals overcrowd and our population ages, the time to build momentum towards a better home care service is now. In 1984, Tommy Douglas, Canada's father of Medicare, said this: "Let's not forget that the ultimate goal of Medicare must be to keep people well, rather than just patching them up when they get sick. That means clinics. That means making the hospitals available for active treatment cases only, getting chronic patients out into nursing homes, carrying on home nursing programs that are much more effective. We can't stand still. We can either go backward or we can go forward. The choice we make today will decide the future of Medicare in Canada." Indeed, Madam Speaker, the same holds true today. The choices we make or fail to make will decide the future of our Medicare system. Madam Speaker, it's time to envision and actuate the next essential phase for healthcare in Canada, and that is transitioning from an acute care model to one that includes greatly expanded community care, including home care. In recent weeks, I've had the opportunity of meeting with a variety of healthcare providers from across Canada. Through these conversations, I see a clear, shared consensus emerging for a patient-centred, sustainable, community care healthcare system across our country. Recall the old saying, "An ounce of prevention is worth a pound of cure." Community care provides the great opportunity not only to deliver better care to Canadians, but also to save our system a great deal of money. We know that a patient in hospital costs $1,000 per day. We know that extended care homes cost an average of $130 per day. And we know that home care costs an average of $55 per day. While the fiscal argument here is plain, more importantly, we also know that Canadians will enjoy better health when they can stay at home and receive care in their community. Imagine if we created a new system where $55 a day were dedicated to each Canadian patient in need of home care services. Imagine if those $55 funded rotating visits by healthcare professionals. Monday, a visit from a nurse to help with medications. Tuesday, a visit by a personal care attendant to help feed and bathe the patient. Wednesday, a visit from the local paramedic to take blood pressure and assess health. Thursday, a visit by a speech pathologist and audiologist to preserve speech and assess hearing. Friday, a visit by a physiotherapist to help with mobility and so on. Imagine creating a healthcare system where prevention and care were brought into the home of each and every patient demonstrating need. Madam Speaker, with visionary leadership and the appropriate funding, we can improve the delivery of care for all Canadians, save money, and ensure better patient outcomes. Will this government do so?
The Honourable Parliamentary Secretary to the Ministry of International Development.
Thank you, Madam Speaker. I appreciate this opportunity to stand in the House today to discuss the Government of Canada's commitment to support improved access to home care services across the country. We know that the majority of Canadians want to stay independent for as long as possible and receive the care they need in their homes and in their communities. That is why our government has committed to working with our provinces and territories to support them in their efforts to make home care more available for Canadians across the country. Our goal for Canada's healthcare system has been and continues to be improving its efficiency and delivery, all while maintaining its universality, particularly for our seniors. Recognizing Canada's aging population, as well as growing rates of chronic disease, we must pursue a shift of our healthcare systems from a predominant focus on providing institutional care toward a greater emphasis on providing care both in the home and in our communities. After all, Canada's publicly funded universal healthcare system has not only been a source of pride for Canadians, but also a source of security for the middle class and those who are working hard every day to join it. While healthcare falls under provincial and territorial jurisdiction, our government is committed to working with the provinces and territories to ensure equitable access to health services for all Canadians. This includes collaborating to develop a new health accord that will support the delivery of more and better home care services. In October, Canadians elected us on a platform that will, among many other things, work to strengthen our publicly funded universal healthcare system and ensure that it adapts to new challenges. As part of this goal, Madam Speaker, we will follow up on our campaign promise to work with the provinces and territories to ensure that Canadians have more access to high-quality in-home caregivers, financial supports for family care, and, when necessary, palliative care. We know that healthcare across Canada is changing at a rapid pace, and our government remains committed to keeping up with the diverse needs of an aging population and advancements in health technology. And we will be an essential partner in improving not only outcomes, but also quality of care for all Canadians. Madam Speaker, though our government is only 6 months old, we have taken a significant first step in advancing the Health Accord as a federal, provincial, and territorial health ministers' meeting was held this past January. There, health ministers agreed, among other priorities, to work on improving home care to better meet the needs of patients closer to home, including those who need palliative care. Already, federal, provincial, and territorial officials have started preliminary discussions related to areas of potential change to support the delivery of improved home care services. Given the importance of advancing work on the Health Accord and our shared health priorities, health ministers will meet again later this year to take stock of progress and decide on next steps. Madam Speaker, Budget 2016 reaffirms our government's commitment to working in partnership with provinces and territories to negotiate a new multi-year health accord. This commitment has been applauded and welcomed by major healthcare stakeholders across Canada, including the Canadian Medical Association and the Canadian Nurses Association. Moreover, Budget 2016 also works to strengthen the middle class by providing immediate investments to support progress on Health Accord priorities in the form of assistance for innovations within our healthcare system. This includes $50 million for Canada Health Infoway to support short-term digital health activities in e-prescribing and telehome care. This also includes $39 million to the Canadian Foundation for Healthcare Improvement to support its ongoing efforts to identify and introduce innovations in the healthcare system. Thank you.
The honourable member for Vancouver Kingsway.
Madam Speaker, since the NDP first broke ground on providing universal hospital insurance in the 1940s, Medicare has come a long way. From hospital insurance, we moved to full medical insurance for all necessary treatment, and we've built a system that, at least in principle, provides health care based on need and not ability to pay. However, I'm still concerned that we have stalled in delivering the next generation of comprehensive health care coverage for Canadians. In my meetings with groups like the Canadian Dental Association, the Canadian Counselling and Psychotherapy Association, Speech, Language and Audiology Canada, and other health groups, I was reminded that many health services critical to Canadians' well-being remain outside of universal health coverage and must be paid out of pocket. We cannot separate mental health from physical health. We cannot separate oral or hearing health from physical health. Madam Speaker, I believe it is time for a national leadership to extend public health insurance into new domains of care to strengthen health delivery for all Canadians. Does this government share this belief?
Honourable Parliamentary Secretary to the Minister of International Development.
Thank you, Madam Speaker, and I thank my colleague for his interest and advocacy on healthcare. Universal healthcare is indeed a core Canadian value, and I would like to reiterate the government's commitment to support the delivery of more and better home care services for all Canadians. As previously noted, while healthcare falls under provincial and territorial jurisdiction, our government is committed to working collaboratively with our provinces and territories to develop a new health accord that will ensure more access to high-quality in-home caregivers, financial support for family care, and, when necessary, palliative care. Budget 2016 further highlights the importance of this commitment and provides immediate investments to support pan-Canadian progress on health accord priorities. While discussions are ongoing, we are working continuously toward the development of a new long-term agreement, including a $3 billion investment in home care. We look forward to announcing details once the agreement has been finalized. Thank you.